According to the CDC, the United States has kept measles cases under control for almost 20 years. Health experts say cases are on the rise. They say when it comes to an outbreak here in Tennessee,
it's kind of just a matter of time.
Health officials like Dr. Bennett recommend vaccination rates should stay at 95% or higher. In Tennessee, the rate for children who received an MMR vaccine in 2023 is 90%. And that number is lower in neighboring states.
Just across the border in Georgia, they're in the high 80s.
With parents requesting more vaccination exemption forms from schools, medical professionals here with the Children's Hospital at Erlanger and the Vanderbilt University Medical Center in Nashville say that receiving a vaccination could be the only way to protect yourself and children in your family from measles.
The areas where unvaccinated people tend to aggregate, places like schools, will be typically the most vulnerable spaces for an outbreak to be initiated.
There are parents out there who are withholding their children from vaccination, and therefore there are susceptible children here in the United States.
So is there any way to protect yourself without a vaccination? Dr. Schaffner, who is a professor of infectious diseases, doesn't think so.
The only way it can get back in is if parents don't vaccinate their children.
He believes these vaccination rates began to dip after the COVID-19 pandemic.
And that vaccine, of course, became very politicized.
Both agree if an outbreak were to happen, it could end in a public health crisis.
There's almost always a real delay in the diagnosis. This permits the virus to spread even further.
We could be many cases in before we realize what we're up against.
In Chattanooga, Mary Beth Mangrum, Fox Chattanooga.
Thanks for watching News Channel 9. And for more great local coverage, don't forget to hit the subscribe button and turn on notifications. News Channel 9, depend on us.